Hi, Astha, we can start. Well,
Yes. Hello everyone, and welcome to today's YouTube live on the ICHARS channel. Thank you so much for joining us today. Today we are discussing a very important and often overlooked topic: barriers in helping behaviors in Indian men. These conversation aims at shedding light on emotional, cultural, and psychological challenges that prevent many men in our country from reaching out for support when they need it. I am Aastha Prabhakar and I will be leading this session today. And it's my pleasure to introduce our esteemed speaker for the day, Mr. Nitin Shah, the CEO of our ICHARS and a seasoned psychotherapist with extensive experience in cognitive hypnotic therapy. With this deep understanding of human behavior and therapeutic processes, Nitin sir will help us explore the different layers of these issues, understand what truly stands in the way of help seeking behaviors in Indian men. Thank you all once again for being here with us today. So let's begin our discussion. Should we go ahead, sir?
yes, Astha, we can do it. Thank you
Yes.
for hosting us and for taking this conversation forward.
Yeah. Sir, to set the stage, I would like to begin with a bigger picture. Nowadays, a lot of research have often shown, that the men in India, or the scale of men health-seeking challenges in India, especially, is low. Could you brief us, describe to us that what we know about this picture and how masculine norms seem to contribute to this?
Okay. So before we begin, hello everyone. Those of you who have joined us or will be watching us later on, I hope this conversation that we have will be insightful, meaningful for all of you. We plan to have these conversations more frequently. So at any point you feel that there are certain topics that you would like us to take up, please share it in the comments on whatever show platform you're following us on. And I'm sure we will take up one of those topics going forward. Today's topic was a result of a request that was made earlier to us by one of the viewers. So we have decided to go ahead with this particular topic today. Uh, I have Astha with me. She's one of our students, and she has been very kind enough to help us in hosting this particular live. So, thank you, Astha. Welcome for being a part of this particular conversation. And for those of you who are joining us, like I said earlier, let's get started. And I hope you find this conversation meaningful and insightful. Astha, now, if you could just start with the question again.
Yes, sir. Research has often highlighted the fact that when it comes to mental health challenges in India, men generally have low health seeking behaviors. Could you describe to us, what we should know about this picture and how these masculine norms that our society has formed, contribute to these behaviors?
Okay, so let me begin with from here. First, the scale of challenge is huge, but it's mostly invisible, which means there are a lot of men also struggling with mental health challenges, but it's not something as evident or as visible as ideally it should be. Why is that the case? Because men in general, and especially in India, are taught very early to be tough, to not cry, to not burden others. You know, we have heard these conversations like, um, uh, आदमी होके रोता है क्या, या फिर कि अपने आप अपनी चीजों का ख्याल नहीं रख सकते क्या, why do you need to depend on someone else to take care of things for you? Be the man in the house. Now all of these statements influence the way we perceive life, we perceive challenges, and we perceive the idea of seeking help. So, if all along I have been asked that as a man I need to be able to take care of myself, I should not depend on others. If anything, others should be able to depend on me. then when the time comes to seek help, when I'm struggling, would I be comfortable seeking help?
Yeah.
Right? And for many people, this feels like a failure, that I am supposed to take care of others and I am seeking help from others. That acknowledgement that I need help at times is equivalent to acknowledging that I'm a failure, which, to be fair, is not true, but that's how it gets perceived in the minds of many people. So, to summarize, it's not that men don't feel, it's just that they're taught to hide it, and some of them end up doing a very good job of it, sadly for them. Um, so that's about why this issue is so big and so challenging. Second is how is, with what you asked me, I think you mentioned something about masculine norms, right?
Yes, sir.
See, so as far as masculine norms are concerned, there are a couple of things that happen. First is a lot of men have these internal rules where sadness or fear is interpreted as weakness. And one, I may not want to acknowledge that I'm weak, and surely I don't want others to know that I'm weak. So, what do I do if I'm feeling sad or afraid? I would generally push that feeling down. Thereby, I'm hiding it from myself and I'm also hiding it from other people around me. Then there is the problem as far as masculine or men are concerned, that men are expected to be the provider, they're expected to be the protector. Now, if the protector has to seek protection, it's almost like we are breaking the role. We are not able to play the role that we are supposed to play effectively. So we are also trying to guard that role of a protector or a provider in our own heads. And lastly, since men are supposed to be provider, protector, at times the interpretation is that if I seek help, then I would lose the respect of people around me. They will not trust me. Maybe the current status that I have, that status will get affected. So all of these things together are derivatives of how the masculine norms exist. And as a result of that, we are affected the way we are affected. Does
Yeah,
this sound
very
correct?
true, sir.
Does this make sense to you, Asta?
Yeah, yes, sir. Yes, sir. It does. It does actually tell us, these masculine norms, they are actually nothing but these stereotypical behaviors, which, the tendency to fit in is something which plays this kind of the role. That I should not seek help, or I will lose that place if I just seek help. So I just wanted to know if you could also
So
guide,
just
shed
before
some
we go
light
ahead,
on.
just before we go ahead,
Yeah.
Asta. So for men, many a times this is also connected to their identity. As we are growing up,
Mm,
we identify with certain roles, certain aspects, certain people, certain labels. And our definition of how life is supposed to be comes from those things that we have identified with. Our beliefs come from those identities. And then they are the ones that are shaping our behaviors, our responses, both external and internal.
yeah. So these beliefs that, or these identity that I have shaped is actually pressurizing me to not seek help when I am in distress, is in case of men.
So it's pressurizing me to not seek help. One. Second, even when I'm trying to seek help, I want to be very hush hush about it. Two. Third, more importantly, in order to seek help externally, I need to first acknowledge that there is a need for help. And many a times, these norms, these identities become the reason why we start lying to ourselves, because we don't want to acknowledge that we have not been true to that identity that we have accepted.
Yeah. So there is a possibility that there could be chances that I am aware, but I am not able to seek help because of these stereotypes. Is what, yeah,
So both things are
yes.
possible. That there are challenges. At times, it is possible. At times, I'm not even sure whether help is available for the kind of challenges that I'm facing. So since I don't know help is available, I can't seek help. Second would be where know that is available, but all these stereotypes are stopping me from seeking the help. But there can also be a possibility where the stereotyping has become so strengthened in my system that I'm even not willing to acknowledge that I need help. And it's not that I'm lying to others, it's simply that I myself don't recognize that I need help. And this could also be a result of those norms that we have been brought up with.
Yes. So this actually brings us to a thought like, if there are so much resistance, there is so much stereotype against men going out and seeking help. I wanted to understand, what and how do they actually show up in distress? From your experience, how do men present their symptoms differently? How do they externalize it? How do they how do and what kind of risk and misdiagnosis can happen in case of men, especially when I am doing therapeutic sessions with them, or whenever I how do they show distress is what I want to understand, because there's so much happening with them and experiencing distress. So how would it be like when I show it up?
Okay. See, so obviously, in general, different people show distress differently and respond to distress differently. Right now, when we are talking about men, what I'm going to answer is based on a broad generalization, which will be true for most men, but not all men, right? Because obviously, as humans, we all are different, and there are possibilities that each of us have our own ways of managing, addressing, showing distress. Now, coming to a more generalized understanding, uh, in general, you will notice that men don't show sadness, or at least they don't like acknowledging sadness. That sadness will be reflected more in terms of anger, irritability, maybe withdrawal. They will become workaholics. Some of them may actually get involved into substance abuse or substance use. There could be physiological symptoms like headache, stomach issues, sleep problems. So, this distress, while they may experience internally, is more visible in their behavior, right? And the behavior at times may not necessarily match the emotion that they're experiencing, but it still is an expression of the distress that they're experiencing internally. As far as what you need to be careful about as a therapist when you're working with them, one, when men show anger, don't just blankly categorize it as a personality flaw. Um, Sometimes their anger is simply a representation of the sadness that they may be feeling. It may be representation of helplessness that they experience. So you may need to at times dig a bit deeper to understand the relationship between the symptom that they are causing and probably the underlying emotion that they are feeling. Second, with men, many a times, their vocabulary of emotions or their ability to understand their emotions is relatively limited. Again, this is a generation, but it's true for most men in general. Um, so you have to be careful when you ask them, how are you feeling? And you're expecting a more nuanced answer from them in terms of sad or guilty or regret. At times, they may just give you responses which are not good, a bit off. Um so you have to be more careful. They may not be able to give you those pinpointed emotional responses. The psychoeducation relating to emotions may be missing, and therefore, as a therapist, you may need to first psychoeducate them about what emotions are and give them a reference point to understand basic emotions. In the way we work, we generally use the flip model to help people understand what the basic emotions are, and to also make and also to understand under what circumstances would they generally be feeling what emotions.
Yes. Sir, so actually now, since we were talking about this training barriers and men seeking help, I just wanted to understand that, if there is a person who just goes out and seeks help. So in Indian context, when it comes to family honor and respect, and when people do seek therapy, this could seem for somebody as a cultural betrayal that they are doing, or loss of status for some men. Then how do these, how can we as therapists deal with that? Because that will somewhere come in the therapy also. When this person comes to seek help, okay, they might have this feeling, or they might carry this effect, okay, oh, am I betraying my cultural belief systems, or am I betraying, what about me when I seek help, what about my respect, it goes down. So this would come in my work when I'm dealing with them. So how do I cope with it?
Okay. So there are two parts to it, right? One, what happens before the person comes to us for therapy, and when they're struggling with these thoughts and so on, and why are they struggling with these thoughts? And second, what happens once they come to us for a therapy session, right? And how these feelings can influence the therapy process by itself. So let's look at each of them one by one. Um, See, like I said earlier, for men, many a times while they are growing up, the understanding is you are the provider, you are the savior, you are the protector, take care of the family, which means if I need help, one, I have not been able to play that role effectively, which means I need to play that role. Second, my family would ideally be responsible for preparing me to take this role up. And if I am not able to take this role up effectively, then in a way I am acknowledging that my family did not do a good enough job of bringing me up. If I have to go to a therapist, talk about my problems, then I have to also acknowledge that my family probably did not do the job they were supposed to do. Plus, some of my problems may also be a result of what's happening in my family right now. So I will have to disclose a lot of information, a lot of secrets that I may not be comfortable enough disclosing, simply because it would mean that I'm betraying my family. And me, because my role is the role of a protector for the family, provider for the family, disclosing family secrets, betraying the family is something that probably will be non acceptable for a lot of these people who identify with this idea, right? So when someone has such strong ideas about uh, their family and the role that their family should have played in their life to make them who they are, and in their inability to play the role that they were supposed to play, the resistance to seek therapy increases dramatically. Now, here, if you know of someone like this, you need to be able to reframe your conversations with them from an understanding that seeking therapy means betrayal of my family to I'm seeking therapy because I'm responsible for my therapy and I can, because I'm responsible for my family. And in order to take care of my family, I need to be in a mentally, physically, emotionally healthy state so that I can take care of this responsibility more effectively. So, do you see the reframing that's happening from me putting responsibility for not being in the right position on my family to me taking up responsibility for my family, and as a result wanting to prioritize myself to improve my mental, emotional, and physical health?
Yes.
This has a potential to make them open to seek therapy, especially those um, who have this strong associations with the idea of being a responsible person for the family. Now once they come in for a session, then our sessions, then therapists ideally are well equipped or should be well equipped to help clients address all of these associations, um, to actually be able to help them see how seeking therapy is not about betraying your family, but actually by is about at times prioritizing your family, right? Because you can only prioritize your family if you are in a state to be able to do what is required to be done for them. Those things can be taken care of in therapy and are generally easier to address. When I say easier to address, I'm saying compared to people who are not even seeking therapy. Second, there are processes available now. Like I said, for a lot of men, it begins from identity. What I've identified with. We have processes available now. There's levels of transformation which can actually help people explore where their identities are coming from, how their identities have influenced their beliefs, how their beliefs have influenced their behaviors, and how those relationship between the identity, beliefs, behaviors is eventually leading to the current set of challenges they're facing in their life and the challenges that they may knowingly, unknowingly be creating for the other people in their family. So, because of those processes, once the client is able to understand the relationship, they are more than willing and they are more than supportive to actually take this process forward and seek help.
Yeah. Yes, that is very, very insightful of the idea of reframing it. Sir, since many of our viewers are related to psychology, some of them are students, some of them are also early practitioners, I would want to little zoom in and add about the assessment part. Like, how do I differentiate between, what might be a normal coping mechanism for men and from the patterns that could raise some clinical concerns. How do I differentiate that? Because sometimes overdoing of some normal behavior can also be a could be a matter of concern, could raise a concern. So how do I differentiate that
See, so
when it comes?
the that criteria remains the same whether we are talking about men or women or people from any gender, right? Or people from any age group for that matter. Uh, when you have normal coping mechanisms, they are more contextual. There are specific contexts where we are using specific coping mechanisms. They are also more temporary, right? Uh, Even if I'm experiencing a particular emotion which is bothering me, probably I'll experience it for 1, 2, 3, 4 days, but it would not impact my functionality to a large extent over a longer period of time. Or I will not be feeling that emotion for that long. There will be phases in between where things will go up and down, but the emotion will, um, most of the times, I'll be able to feel what I'm supposed to feel as per the given situation. When we talk about clinical issues, what we are really saying is there is a particular feeling which is sustaining for maybe more than 2 weeks. And even in situations where probably things around me are becoming better and yet my feelings still remain the same. Now, there are two things that can happen. One, it may completely impact my functionality, which means I may become completely dysfunctional, which is more easily witnessed. It's seen. I may withdraw. I may not do certain things that I'm supposed to do regularly, and I'm not doing this for an extended period of time. Now, here it may be a good idea to first check if the person that we are talking about actually has a clinical issue and do they need help from a psychiatrist as well. Second, at times people can be highly functional, but internally they are constantly feeling certain emotions that they realize they should not be feeling it to this extent and at this frequency and for an extended period of time. Now, this is something that generally is more evident to the person themselves. So, if you know of people around you when you're having a conversation with them, when you ask them, they will tell you that, you know, there's a sense of emptiness that I'm feeling nowadays. It's almost like I'm losing interest in everything that I'm doing. I'm doing things because they're required to be done, but I'm not really as passionate or as happy about doing the things that I was earlier. Now, when someone continues to have this for a few weeks, then you know that you want to check further, and maybe it's a good idea to ask them to visit a therapist or a psychiatrist, as the case may be.
Yes, that's
And
also
also, when we are talking about men, with men probably focus more on behavioral related questions to identify this, where this problem has continued for a longer period of time. But if you ask them, have you, for example, if you're having a conversation, someone says, I've been off, and you tell them that, all right, so this emotional discomfort that you're having, has it remained there for more than 2, 3 weeks? They may not really understand the concept of emotional discomfort. But if you ask them in the last few weeks, has there been a lot of impact on your behaviors, things that you want to do but you have not been doing, or that you have not been doing as well as you would like to, there the answer will carry a insight.
yeah. That's very interesting to know. Sir, now linking to that, not all men are same. So noticed any demographic patterns when it comes to men? So for an example, like men from urban area would be a little more open to seek therapy compared to men from rural areas. Just like that, younger generation would be more open to seek therapy compared to the older generation. So when it comes to help seeking behaviors, are there any demographic patterns where you have seen that some group of men are more reluctant, some are more open, and what could be the reasons for the same?
So again, this is a generalized answer because in each category of people there can be exceptions. But as a whole, when you look at it, you will notice that younger people, people probably who are in colleges now or just getting into work, are more open to the idea of seeking therapeutic help. But simply because there's so much more awareness, there's so much more openness about the entire conversation amongst this age group of people, right? Especially urban young people. As far as rural men are concerned, the stigma is still very high. Also, the accessibility is relatively low. Their comfort with tech in terms of seeking therapy online is also relatively low, and therefore, this will be the category of people who will probably have the biggest challenge and least amount of help. Then, when we talk about people who are in the middle age, the previous generations, actually, to be fair, even people in the middle age more or less are now relatively more open, but senior citizens still may struggle with, senior men may still struggle with the idea of seeking help via therapy, because again, this identity shift has started happening, belief shift has started happening amongst men also, even in urban areas, but there's still generations where their identities are very fixated in the way it is right now. Plus, people who are seniors would generally seek help more for psychosomatic issues. They may not really understand the idea of seeking help for emotions, but when they have chronic aches, pains, which doctors are not able to explain, doctors are telling them this is psychosomatic, you need to visit a psychologist for seeking relief from that pain. They may come for therapy. So the nature of problems that they will have will slightly be different. Uh, to summarize this, young urban young men would probably be most open. Young college going students right now have just joined their work, so basically between 18 to 30, these are the people who will be most open. Rural men would have other challenges and the stigma is relatively a lot higher for them. For senior citizens, the problem is their uh, strengthened identities about the roles that we spoke about earlier. But at the same time, they are open to seek help for psychosomatic issues.
That's because we have seen those trends. Like now it is changing because in my college I do have students. Male students would come up and say, "Oh, ma'am, I think I need therapy and I should go for help." So which is also kind of where I see that yes, now there are changes which is coming up, and that is a good thing to see. The reluctance with generations is going down, and men are becoming more open for it, for therapy, for help seeking behaviors, which is also very very good.
So
Now
there's
that
both that is happening. So at one level, it's very good that more and more people are becoming aware of mental health, mental wellness, and so on. But the lack of clarity between what is mental health and what is mental wellness and what is mental illness is still very high. So what happens is today a lot of people knowingly and unknowingly. So there's one category of people who are just not aware and therefore they're not seeking help. There's another category of people who have gone to an extent where everything for them becomes a mental illness issue. Right? So we have not yet found the right balance, but it's still better than earlier because at least people are talking about it. Sooner or later, both groups of people will be able to find that balance, and hopefully, we will be somewhere more in the center. where
Yeah.
we should be.
Yes. So now that we have understood the barriers, I would want to know about what actually helps. So when it comes to therapeutic techniques, the model that we have, what are the things that I as a therapist can use to help people out there?
So, to be fair, this is not just true for men. I would also apply it for women in terms of the way we work, or to people from any gender for that matter. Um, but again, specifically because we are doing a conversation about men, one is when people are seeking help, they want to see results, right? Especially if a man comes to you who is brought up with that idea of value for money, being a protector, I need to see results, things need to be more actionable. So they also expect those kind of results from therapy. So as a therapist, if we are going to only focus on their emotions and their emotional wellness without helping them connect how this emotional wellness would really translate into action, would really translate into results in their life. What tangible changes will they experience and notice in their life? Then their compliance with continuing with therapy is limited. But if you're able to explain it to them in the first session, how working with their emotions, their thought processes, not only help them feel better, but it actually influences tangible things that are happening in their life. It actually can help them become more productive, can help them take care of themselves and their family better, can help them improve their relationships, right? Maybe can help them make more money. All of this becomes very tangible for them to now seek help because they're looking for those tangible, identifiable end results. Second, you may still need to work with emotions, but emotions are the underlying currents that we work with. You always begin with the surface level symptoms, which are more tangible. And then from there, when they get stuck with addressing those symptoms, there are delayering techniques that are available, which you can use to help them identify what the underlying causes are and then work with those causes as far as possible in the same session. So that at least they can start seeing observable difference in the coming week. Right? See, it's simple, right? Once people start seeing observable, tangible differences in their life, automatically they are more open to continue with therapy.
Yeah.
Now, in terms of, so just to summarize this, um, focus on specific behavioral changes, help them recognize how all of this will help them solve their problems, how this can help them increase their motivation. Because a lot of men have a tendency to suppress emotions, there is more psychosomatic pains that they experience. So, working with the psychosomatic pains and helping them seek relief from that immediately convinces them that what you're doing works for them. Helping them with somatic grounding may be a very good idea. And finally, at times with certain men, when you try to talk about these emotions literally, it's difficult for them to understand and grasp them. And their metaphor based work may be more interesting and more useful.
Okay. That's very insightful, sir. Because we have so many techniques, and when we are actually able to utilize it to help people understand and see that difference, it really makes a lot of changes in their life, and their belief in therapy would improve. So automatically, that idea, that reluctance would fade away, and that's when we can really help them to overcome these challenges. Also, since have been talking about men's mental health and behavior, and with changing times, we also have a lot of mental health tools, a lot of helplines, a lot of peer interventions. I just wanted to understand, we all have also mentioned the point that, most of men are not aware about having mental health issues. I just wanted to understand, how would these mental health tools, mental health tools, helpline, peer intervention programs help us to reach these men who never walk into clinic, who never seek help, who do not know, what mental health is. How would that bring awareness there?
Okay. So, first, when we talk about mental health tools that are available, let's just break them down for clarity and simplicity. So there could be helplines, there could be
Yes.
chat-based interventions, there could be peer groups which meet online
Yes.
or offline. There can be mobile apps that you can use for your mental and emotional well-being, and there can be therapy and coaching sessions that can be done online. Right? Each of them serve a different purpose. So, for example, helplines are best suitable in cases where there is an immediate intervention required. It's almost like crisis intervention. Someone has a suicidal thought and they want to talk to someone, but it can't be a replacement to full-fledged therapy. Okay? Similarly, peer groups, while they are interesting, they are important because people can talk about challenges. And generally, when most people struggle, including men, the feeling is I am the only one suffering. When you're a part of a peer group and you hear other people talking about similar challenges, you all of a sudden realize, all right, I am not the only one. And many times in many of these peer groups, when people talk about their challenges, they also talk about what they have done to try and resolve these challenges. And others also add in their points about how they have addressed similar challenges in the past. So there's a lot of peer learning that ends up taking place. So they are developing skills, they're learning strategies which can really help them improve and address the current challenges that they are facing in their life. Having said that, many a times just knowing strategies are not enough. The problem is the gap between knowing what needs to be done and actually being able to do it. That is really the gap which therapy, whether one-to-one therapy or group therapy, where you're actually working with a specialist, comes very handy. Many mobile apps are also now designed in a way in which they can help you, at least at the first stage, to make the transition between what you know and your ability to apply that. Right? So, the future, as far as e-mental health is concerned, is bright, but it's also important that we understand the distinction between each of these tools, when to use which tool, and that one tool is not a replacement for another. We recently launched Meet Goals as a mobile app,
Yeah.
which basically includes all of these things that we have spoken about. Um, when we were sitting and when we were conceptualizing the entire app, right, we were looking at something which can be a very powerful self-help tool, but yet we did not want it to come across as if you do this, you don't ever need therapy because you may still require therapy. And then there was a problem that while we can have practitioners onboarded, uh, how do we maintain the quality of the practitioners? Because that is one big area of concern as far as therapy is concerned. One, there are not enough therapists available, and second, many of the ones who are available are not at the level that ideally we would like them to be. So therefore, we made that call that all right, only those people who have been trained by us under ICHARS, because we understand the curriculum, we have trained them, we have mentored them for more than a year, year and a half, will be allowed to join that app. The models that have been added on that app have been added keeping that in mind that they have been tested with clients for the last 12, 15 years, not just by us, but by all the people that we have trained over the years. Right? So the reason I'm speaking about Meet Goals is simply an example. I'm sure there are other organizations, other platforms which may be attempting to do something similar. But there are tools available. And even if you are a man who is uncomfortable seeking therapeutic help because you feel you want to maintain secrecy, at least begin from these apps. If that for any reason is not sufficient, the apps itself will help you connect with the appropriate therapist that you can consult, that you can connect with, and you can do all these sessions online now. So you don't even need to enter into a clinic and come out of clinic worried that someone will spy on you. You could be sitting in your office room as if you're in a Zoom meeting, and you could still be undergoing a very comprehensive therapy session.
Yeah. Actually, with a lot of that Meet Goal app and everything that you have said, sir, I have myself gone through it. It's really very, very, very helpful, and it is really a commendable job that has been done with those apps. And I really hope that it does help people out there, it does help the therapists, psychologists, who want to start with therapy out there. It's really a very, very useful tool. And since we are at almost at the end of our time and almost at the end of the session, I would like to ask you, if there is something that you would really want to tell out to the Indian men, who are struggling but not seeking help, that would really help them. Uh, would that would really help them. What would that be, sir? If you would have to give a message to them.
So if I have to give a message to men out there, right, so my message will be there are a lot of therapists who offer initial consultation as free. Assuming you're seeking value for money, you're not sure whether therapy will help you or not, you're not even sure whether you'll be asked to talk about things that you'll be uncomfortable. All of this you're unsure about right now, right? As responsible men, don't make a decision without enough information. So if you're not sure, first go out and seek information. So visit a therapist, have a conversation with them, understand what happens in therapy, how therapy can help and where therapy cannot help. Check what are the noticeable differences that therapy can help you achieve in your life, and then make an informed choice. If you go to a good therapist and if you make an informed choice, your choice will be that I want to continue with therapy. Okay? But don't make that choice out of lack of information, either to visit a therapist or not visit a therapist. Uh, Go do your research, have a conversation with a therapist. Like I said, there are a lot of therapists who are willing to work with you to help you achieve your outcomes in tangible ways. Many of them also offer a free initial consultation. Remember, consultation is initial consultation is not free therapy. They will generally be able to sit with you and help you understand what therapy feels like, looks like, will be able to help you define your problem and outcome more clearly so that you have a uh, more clearer understanding of what to expect from therapy. That's what my recommendation, my suggestion would be.
Thank you so much, sir, for your beautiful perspective and the knowledge and your experience that you have shared today. I also would like to thank all the viewers for being a part of live session, and really a heartfelt thank you to Nitin sir for sharing your perspectives on barriers to mental health when it comes to help seeking behaviors. I really hope, wish, and pray that this conversation would encourage the viewers to reflect on the role that each of us play in creating more open and supportive and stigma-free environment for men's mental health. And thank you so much for your time, sir. It really means a lot. Thank you so much.
Thank you. Thank you so much. And once again, everyone who's been watching us, if you need any help, please feel free to reach out to us. There's help available. And I hope this conversation has helped you get some insights about how therapy can help and helps us break that stigma that is associated with mental health. Thank you. Bye bye. Take care. Good night.
Thank you, sir.